Go ahead, ma'am.
Good afternoon, everyone. I'm Dr. Parinaaz Parhar. I'm the clinical head and fertility expert at Oasis Fertility, Secunderabad. And today I will be talking about the tips to naturally optimize your fertility. Now, this is something I guess a lot of patients would be interested in. Before calling them patients, a lot of couples would be interested in knowing how do we really optimize our fertility chances, improve our fertility, and optimize our chances of conception naturally. So I'll be talking about it one by one. To start with, the foremost thing which comes to our mind when we talk about methods to improve and optimize your fertility is the impact of age on a couple's fertility. So when it comes to age is a major hindrance as far as the female partner is concerned. A woman's fertility is highest during her late 20s and early 30s. Post 35 years of age, there is a sharp decline both in the number as well as the quality of the eggs. What this really translates into is that as the female partner's age increases, the number of eggs reduces, the chance of conception, of getting pregnant naturally decreases. Even if you conceive, the risk of miscarriage increases, and also the risk of having a child with an abnormality, especially cases of Down syndrome in babies, they tend to rise with increasing age of the mother. So that's why it's important to understand that if you're planning your pregnancy, the chances are maximum when the female partner is in her late 20s and early 30s. Chance of pregnancy is seen to be highest within the first 3 months of trying. In fact, 80% of the pregnancies happen within the first 6 months of trying for most of the couples. Age does impact the male partner's fertility as well, but not as adversely as it affects the female partner's fertility. So, yes, post 35 years of age, there is a slight decline in the male partner's fertility as well, but it is more remarkable when the male partner is more than 50 years of age. So, the impact of age on your chance of fertility, on your chances of getting pregnant as a couple, are higher when the female partner's age is more. The chances of getting pregnant reduce. The second thing which is important to understand is the concept of fertile period, the fertile window. Now, the fertile window is the part of the menstrual cycle of female where you observe maximum fertility. So that part of her cycle when she is most fertile is known as the fertile window. Now, when we talk about the fertile window, it's important to understand the concept of the menstrual cycle. So, what is the length of your menstrual cycle? How do you determine that? So, day one of your cycle is the day when your periods start. So, you count the day one as the start of your periods, and from that day until the start of your next periods is the total length of your menstrual cycle. Now, the menstrual cycle is usually divided into three parts. You have the follicular phase, you have the day when you ovulate, which is date of ovulation, and then you have the luteal phase. Now, it's usually presumed that the luteal phase is 14 days of duration. So, if you're someone who has regular cycles which come every 28 days, it would be safe to presume that your ovulation is happening on day 14 of your cycle. If you're someone who regularly has her periods every 30 days, then you can assume that your ovulation is happening on day 16 of your menstrual cycle. So, fertile window is a very good concept which you can use in order to optimize your fertility. So, your fertile window is usually the day of ovulation and 5 days before that. So, this total duration of 6 days is the period of peak fertility in a female. And if you time your intercourse around this time, around this period, then your chances of conceiving are maximized. So you have a lot of applications and a lot of methods available, which are usually basically based around this whole concept of fertile window in order to improve your chances of conception. You have something called as the calendar method. You have all these LH kits, and you have your, a lot of people even track the cervical mucus secretion in order to see that what is the best time to have intercourse. So all this is basically, the whole concept is about to maximize your chances of getting pregnant by timing your intercourse around the time of the fertile window. Now, how do all these methods work? I've already told you about the calendar method. Now, whenever you're planning your pregnancy, once that you have understood what, for someone, this is usually helpful for someone who has regular cycles. This is not very effective. The fertile window concept will not really help for those ladies who have irregular cycles, because their cycles are irregular because they are not ovulating normally. So how do you really track their fertile window? So the concept of fertile window can be utilized by patients where the female is having her cycle regularly. So how do you know what is the cycle length? You track your cycles for the last 3 months. You'll get an approximate duration of cycle, of approximate length of cycle, menstrual cycle for you, and then you can be like, okay, fine. At times my period comes every 30 days. At times my period comes every 28 days. So approximately it's around day 14 to 16 when I'm ovulating. So my fertile window is approximately, say, about day, somewhere between day 9 to 11 for me. So that's the way you can track your period of peak fertility. Now, how often should you really be timing your, how often should you be, what should be your frequency of intercourse during this fertile window? Now, there's a lot of debate regarding, and there's a lot of misconception regarding this. A lot of couples come to us and they'll be like, my God, we are like, we are tracking this fertile, we are aware of this fertile window concept, but in spite of us having having intercourse 3 to 4 times a day, we are not really conceiving. Or then we even do have patients who come and tell us that, we are actually abstaining since the last 10 days. We want to time our intercourse only on the day when we are going to ovulate according to this whole concept. See, both of these are very extreme measures and they're not really required. Moderation is the key here. So the peak, the best way to try and optimize your chances of conception is to keep a frequency of about having intercourse of at least every 1 to 2 days during that fertile window. So if you're not able to have regular intercourse, for couples who cannot try and have regular intercourse during the whole cycle, and it's possible to meet only during specified days, please try and time your intercourse to at least about every, either daily or once in every 2 days, alternate days during your fertile window. It has been seen in various studies that even having intercourse every day, as frequently as every day, does not adversely affect the quality of the semen parameters. In fact, for some patients where the male partner's semen parameters are not very good, keeping intercourse daily might actually help in improving the sperm parameters. So please don't think that, oh my God, I'm trying to save the best sperm semen for the last day when it's going to be most effective. It doesn't work like that. The longer the duration of abstinence, the longer the time since you have last had intercourse, usually the sperm quality tends to be poorer with increasing duration of abstinence. So if you have to talk about what is the frequency, well, I would say that frequency should be about every day or alternate day during your fertile window. Now, how do you track this? You can, like I told you, you can either do it with the help of the calendar method where you kind of track that when would it be. You have various apps which are available online in order to help you track this. And they have been shown, actually, various studies have said that they can be as good as 21% accurate in predicting your exact date of ovulation. You have the LH kits, where usually what happens is that in this fertile window, you start using these kits, which are like the urine pregnancy test kits, and you check the urine every day in the morning. You can do it actually twice a day. And you see for the appearance of two lines, you check for the detection of an LH surge. Now, suppose if the kit shows that the surge has happened, you can expect the ovulation to happen anytime within the next 2 days. So those are the 2 days when you should actually increase your frequency of where you should actually have your intercourse. The other thing is, which also a lot of people talk about, is you should be aware of it if you're planning a pregnancy, something about the cervical mucus and the change in its consistency during your fertile window. So your cervix, which is the mouth of your uterus, it tends to produce a certain amount of mucus. And as during the period of fertile window, as your body's hormone production the estrogen production increases. There is a significant change in the consistency of this mucus which is secreted by the cervix. So as you approach ovulation, this mucus tends to become consistently more slippery and like egg white, and the volume of the mucus also significantly increases, so much so that the maximum secretion of the volume of maximum secretion of mucus is seen on the day of the ovulation. So that can also help you know a bit about your body and approximate date of ovulation. It can help you know about that. So these are various methods which are available, which can give you some hints about when you are ovulating, and you need to understand that your chances of conception are best if you time your intercourse approximately 5 days before your expected date of ovulation. Okay, so that's about your fertile window and how you can capitalize on that concept in order to optimize your fertility. Now, for those patients who have irregular cycles, what do we do about them? Well, for them, you need to understand that your cycles are irregular either because you're not ovulating at all. Well, in that case, you would need to seek help from an infertility expert who will give you certain ovulation drugs in ovulation induction drugs in order to help the follicle grow and then ovulate. Or your cycles are irregular because your follicle is just ovulating anytime. I mean, it's very difficult to predict when it's going to ovulate. So if it just tends to happen to ovulate, but it's not coming on a specific day of the cycle, well, in that case, your chances of conceiving can be maximized by trying to have intercourse at least once in every 3 days. So it's not possible to tell these patients that, okay, fine, do it every day, but at least try and have intercourse about 3 to 4 times a week, and that should serve the purpose in case you're ovulating at all. But if you've tried that for about 3 to 4 months and it's not helping and you're someone with irregular cycles, please consult your gynecologist to have you evaluated and to help you be started on ovulation induction drugs if required. Now, the next thing which a lot of patients ask us about is that, is there any particular coital position which is really going to help increase our chances of pregnancy? No. A lot of patients have this misconception that, if we lie down for about 15 minutes, 30 minutes, some even talk about up to an hour post having intercourse, the semen will not leak out and, we have maximum chance of getting pregnant. All of it does not really help. There have been studies which have actually proven that it's not really effective. The simple logic being that as soon as you have intercourse, as early as within 2 minutes of having intercourse, sperms have been found in the fallopian tube. So that's how fast they tend to migrate. So it's really not helpful that you try to lie down for long or assume a certain position during intercourse to maximize your chances of conception. Unfortunately, all of that really does not help much. There's no evidence which says that this is the particular position or this is the duration of lying down which will help you. The other thing which we need to understand is about the use of lubricants. A lot of patients tend to use lubricants in order to, at times the female partner has a history of painful periods and pain while having intercourse, and there's a lot of apprehension. So the couples tend to use lubricants in order to make the whole process less painful. Well, you can go ahead with it, but if you're planning your fertility, if you're planning your pregnancy, well, in that case, try and go for hydroxyethyl cellulose-based lubricants. Consult a gynecologist, consult your fertility expert to know which is the right brand and all, which will help. Because a lot of these lubricants are known to have certain chemicals which will actually kill the sperms and be counterproductive. So they reduce the sperm vitality as well as the motility. So it's important that you consult your doctor whether the lubricant which you're using is actually not harmful to the sperms and responsible for reducing your fertility. The next thing about optimizing your fertility is the role of diet and your lifestyle. It's a no-brainer to say that a healthy lifestyle obviously is going to improve your chances of pregnancy. But what about the diet? There are a lot of fads that Mediterranean diet is the way to go, or a high-fat, dairy-fat diet, or a pure vegetarian diet, or something which is high in seafood is good for you. None of these have actually proven to be beneficial. If you're someone who has their weight in the healthy range, in the normal range, by which I mean that if your BMI is between 18.5 kilogram per meter square and 25 kilogram per meter square, I think you're fit enough. Your weight and your diet is not really the problem as far as your chance of conception are concerned. But yes, healthy eating practices are advocated, but there's no particular form of diet is really found to be very beneficial. It is advisable that if you're planning a pregnancy, please start using folic acid supplements around at least 3 months prior to when you're starting to planning to get pregnant. And the dosage is usually about 400 micrograms per day. Most of the medicines, the over-the-counter supplements which are available in our country usually contain about 4 milligram, which is more than enough. And that's something which all of you should take. But as far as diet is concerned, if your weight is in the normal range, no worries. If you're someone very thin, then please get yourself investigated if there's any pathology, if there's something wrong which is responsible for the weight loss. And because having a very low body weight is also associated with certain adverse effects like increased risk of preterm labor, which we would not like. So yes, having your weight in the normal range is important. If you're someone who is on the heavier side, definitely highly recommended that you should lose weight and come down to the normal range, because being on the heavier side is going to increase your risk of diabetes, hypertension, and have adverse outcomes in your pregnancy, which no one would wish for. So if you're planning a pregnancy, it is advisable that you consult a dietitian in case your weight is not in the normal range, and get a body mass index which is within the normal range. If you're someone who has PCOS and who is having irregular cycles, even a slight weight loss, if you're slightly on the heavier side, is highly beneficial for you. And especially for PCOS patients, it's advisable that they go for foods which are having low glycemic index, and try to restrict the dairy consumption. And even weight loss of as low as 5% of weight loss is found to be extremely helpful in these patients, and in improving the egg quality and improving their ovulation possibilities, spontaneous ovulation chances, and improving their chances of conception. Now, another thing is, which a lot of patients tend to ask us, is that is there a certain amount of with our fast-paced lives nowadays, a lot of people end up having a lot of a number of cups of tea, coffee in a day, and they are actually concerned whether that is adversely affecting their chances of getting pregnant. So, as far as coffee consumption is concerned, you can safely have about 2 to 3 cups per day. But yes, if you're someone who has about 5 cups or more, so that is actually found to be adversely affecting your fertility. So, too much of anything is not good for you. So, do restrict your caffeine consumption, not more than 2 to 3 cups per day. That should be the golden rule. As far as smoking is concerned, smoking is known to have adverse effects both on the female and the male as far as fertility is concerned. So, in the female partner, smoking is shown to increase your chances of getting into premature menopause, having a rapid depletion of your ovarian reserve, and it also increases your risk of miscarriage. As far as the male partner is concerned, smoking is shown to reduce the motility of the sperms, and it is also shown to increase the DNA fragmentation index of the sperms, and both of these tend to reduce your chance of conception. So yes, smoking is bad for you, and if you're planning a pregnancy, please try and at least see someone to try and cut down on this habit. Alcohol consumption, um, bad for both males and females. If you're planning a pregnancy, please cut down on your alcohol consumption. And once you get pregnant, it's a big no, because it really affects the baby adversely. And in the male partner also, if you're someone who regularly drinks and tends to binge drink a lot, alcohol consumption is actually seen to adversely affect your sexual life. It leads to erectile dysfunction, ejaculation problems, and it also chronic alcohol consumption tends to, in the long term, affect your testosterone production and reduce your sperm production. So alcohol is again something which you should really restrict usage of if you're planning a pregnancy. So I hope you have this Facebook live session today has helped you understand a bit more about what is the right age to plan a pregnancy, and what about the fertile window, and what are the various methods by which you can try and understand the concept of fertile window and increase your chances of pregnancy. If you have any questions about this particular topic, please feel free to drop it in the chat. If you put them now, then I'll just answer them. Otherwise, we can always get back to you. See, the main purpose, can folic acid boost ovulation? The main purpose of folic acid consumption is to reduce the risk of neural tubal disorders in the baby. So diets which are found to be deficient in folic acids, like consumption of too much of maize. So and there are certain other millets which whose consumption is associated with low folate in the diet. So areas where this kind of diet was being used, there it was observed that there was a higher incidence of babies having neural tube defects. So they were found to have certain problems with the brain at birth or with the spinal cord. So that's why it's one of the things where if you take a certain supplement in the diet, it helps in avoiding a major deformity in the baby. So that's the reason why it is advised to take folic acid supplements if you're planning a pregnancy, because the benefit is much, much, much more and there's no risk. So that's the reason. It's not for boosting your ovulation, it's basically to reduce your risk of having a baby with a deformity. So I think someone's asking me to summarize the whole thing. So how to increase fertility naturally? By timing your intercourse, trying to have intercourse in the fertile window if your female partner has regular cycles. And that means that by the you first determine what is the time of ovulation, and try to if you cannot keep regular intercourse, then at least try to have intercourse every day, or alternate, at least every alternate day during the 5 days before and on the day of the ovulation, in order to maximize your chances. Your chance of conception this way will be higher if you are someone who is less than 35 years. Now, if you have been trying this method for the last 1 year, and if the female partner is less than 35 years, and still you haven't been really been successful in getting pregnant, then please consult your fertility expert to understand, help you get evaluated and to understand what could be the possible reason for the failure to achieve pregnancy. If you're someone where the female partner's age is more than 35 years, because of the obvious adverse effect of age on your fertility, it's advisable that within 6 months of trying, if you have not been successful in getting pregnant, please consult your doctor, because we need to be more aggressive in our management when the female partner's age is more. Take folic acid supplements in order to reduce any risk to the child, and take care of your lifestyle and diet. And there is no particular position which is really going to help improve your chances. So those are the take-home messages from this. So that's all for today. Thank you for a patient hearing, and you can always contact us on the number which is there on the screen for any other fertility related queries. Thank you.